Hi, everybody. My name is Brenda Thompson. I am a resident and fellow liaison with Universal Health Services. My role is to help educate residents on lifelong career transitions. One of the topics is interviewing techniques. So we know right now this is a time when residents are interviewing for their next career job. Some might be going into fellowships, some might be going into the actual clinical positions. So I wanted to take maybe about 40 minutes or so and go over some best practices that residents could use to help them land their job or their fellowship. So career planning, you want to first start with the basics. You should personally make a list of your non-negotiables, such as, do you know the region in which you want to work at next? Whether that be the particular state, maybe the great state of Texas, or a region. So maybe the mountain states or the upper Northeast states. You want to make sure that you are getting what is right for you, and if you have a family, what is right for the family. So during the negotiating phase, there are simple factors that need to be looked at. These include where you're going to be most happy at year round, what the environment is like weather-wise. If you like to snowboard, you're probably not going to choose the state of Florida. It's important that you don't just send out your CV to any recruiter that's asking, oh, hey, we have an opportunity over here in Florida. You want to come out? And you say, well, hey, why not? It's not my preferred location, but it can't hurt. Well, I'll get to that in a second of how it could actually hurt you. So you want to work with the non-negotiables that are going on right now in your life, such as where you want to practice. Is it right for your family? You want to look at other things too, such as the practice culture. You want to know what environment that you want to get into. And a good way to do that is to Google. So if you know you want to work in the great state of Texas, perhaps maybe you want to work in the Dallas area, it's a good idea to research the different hospitals or clinics that are in that area, maybe get about 10 or so, and Google the reviews. Google what people are saying about the CEO, which you can easily do on glassdoor.com, and Google what the patients are saying as well. Of course, you also want to look at the practice economy and the growth. Are they growing? We know right now that there are many hospitals that are financially in jeopardy and are closing. We just had one in Detroit, Michigan that ended up closing. So you want to look into these factors to make sure that it's a healthy economy where you're going into, because I'm sure your main goal is to get a lifelong position. You also want to do your research on compensation. And what I mean by that is look at your specialty and look at the particular area which you want to work. If you're looking to work somewhere in Nashville, Tennessee, you aren't going to quote a compensation package that doctors out in San Francisco are getting. Two different economies, two different costs of living. So you want to make sure you do your research, because if you are quoted or asked, I should say, what is your compensation package, you want to make sure that it's a realistic package, because if a recruiter can't work within your budget, they might bypass you. So the first question you'd want to ask yourself is, okay, you got contacted by a physician recruiter. What do you want to do before your interview?
To listen to the rest of this content, you need to be an SMA subscriber. To subscribe, visit sma.org and create a free account to listen to the rest of this broadcast.